How to cure hair loss in 2018, 2019 and beyond. Hair loss is also called alopecia. Hair loss from the scalp or anywhere else in the body. It's like something out of a bad dream. You step out of the shower, dry your hair, and are startled to discover a glaring patch of baldness on the back or side of your scalp. For the 6.6 million Americans suffering from alopecia areata, this bad dream could become their reality at any time. For such a common disease, there's a lot most people don't know or understand about alopecia areata, starting with its name. 1. It's a friendly fire disease. Like all autoimmune diseases, alopecia areata involves your body's immune system mistakenly targeting healthy cells. Your body's natural defenses don't recognize your hair as one of the good guys, so your immune system attacks it. While experts aren't sure why some people develop autoimmune diseases and others don't, your genes probably play a big role. 2. It could come on at any age. Alopecia areata tends to appear during childhood, but it could surface at any age. It can also disappear for decades. It's common to have it as a kid, have it go away, and then have it come back 20 years later. 3. It takes many forms. 4. It could go away and never come back. While a relapse is always possible, sometimes alopecia areata abates and never returns. It's a very unpredictable disease. Sometimes it just burns out on its own, but we're not sure why that is. These are common questions asked by individuals suffering from hair loss. The most common reason for hair loss in women and men is alopecia areata, also known as pattern baldness. It can cause thinning hair or bald patches. Am I losing more hair than I should be? Many people face this concern, and oftentimes it is unfounded. In other cases, hair loss is a big problem. First, consider that the average, healthy person will lose 50 or more strands of hair each day. This is normal and it is a part of the hair growth cycle. You can expect to see your hair shed in the shower or on a brush. In the natural growth cycle, hair is lost after a certain period of time. That hair will regrow later, after a period of dormancy. If you're losing clumps of hair, this may indicate a nutrient disorder, medication interference, or stress situation. It is a good idea to speak to your doctor about these instances. You can expect your hair to thin out, also, as you get older. Is there a cure? Treatment often involves injecting steroids into the affected area, which blocks the inflammation. We'll do this every 3 to 4 weeks for a few months, and a lot of the time the hair will keep growing even when we stop. If the alopecia is more widespread, treatment may involve oral steroids or non-steroidal immunosuppressant drugs. These injections or drugs won't cause hair to grow in unnatural places. They just release the hair follicles from the grip of that inflammation. You can do that, or you can get the Iristor laser hair growth system. About the product: Iristor is a FDA-cleared medical device for treating hair loss, receding hairline, balding and thinning hair. For both men and women see visible hair growth. Users can expect to see visible improvement in as little as 3 to 6 months. Results might vary. Iristor has been clinically studied and proven to promote hair regrowth in a recent 2017 study. In this 4-month clinical study, an astonishing 100% of active device users saw visible improvement in hair growth, with an average increase of 43.23% in hair count. Grow thicker, fuller, and healthier hair with Iristor's clinical strength laser technology. It's not cheap, however. There are other recommendations, such as the NutraStime laser comb, which is clinically proven effective by medical professionals on hair loss patients. It requires the comb to be used 3 times a week for 8 minutes. Users can expect to see visible improvement as early as 4 months and full results in 6 months.